Good morning and welcome to Backchat. I'm Janice Wong and our guest presenter is Jenny Lam.
On today's program, we're looking at the long waiting time patients seeking specialist care through the public healthcare system.
The latest data shows that patients who are in a stable condition face waits of up to 205 weeks or just shy of 4 years in the worst case scenario. The hospital authority explains that queues have become longer due to the knock-on effects of the COVID-19 pandemic.
Chief Executive John Lee has promised to cut waiting times for new internal medicine patients by 20% by 2024. And the hospital authority says is stepping up its partnership with the private sector as part of its efforts to speed things up and get suitable patients diagnosed and treated early. Is this target achievable? What can be done so that people don't have to wait so long?
After 9:15, we'll look at our close shave with Tropical Storm Nalgae, which prompted authorities to issue the first T8 warning signal in the month of November for 50 years.
So let us know what you think. You can leave a message on our Facebook page, Backchat on RTHK Radio 3, email us on backchat@rthk.hk, or give us a call on 233 88266.
Now, to kick off our discussion this morning, we're joined on the line now by Dr. David Lam, Medical and Health Services lawmaker, and Ivan Lin, community organizer from the Society for Community Organization. Good morning, Dr. Lam.
Good morning.
Good morning, Mr. Lin.
Good morning.
Thanks for joining us on the program. Like I just mentioned in the introduction, the latest hospital authority figures show that the longest waiting time for stable new case booking at specialist outpatient clinics is 205 days or almost 4 years. And that's for the Eye Hospital in Kowloon West. And in the Hong Kong West Hospital cluster, the wait for surgery is up to 109 weeks. Dr. Lam, what's your view on these figures and on the general waiting time for public health services?
For quite a long time, the long waiting time in specialist outpatient clinic has been the pain of the Hong Kong healthcare system. But first and foremost, let us look at the figures from a proper perspective. When we talk about the 205 weeks of waiting time for stable cases in ophthalmology, the eye diseases, which is Kowloon West, actually that is the longest waiting time, meaning the 90th centile. So 90% of people would wait less than that period of time, for stable cases. But then you look at the median, it's still not very satisfactory, 167 for Kowloon West. It is very much shorter for other clusters, but for this particular cluster, it is very long. But these are for stable cases. And if you look at eye cases overall, 53% of the cases are not stable cases, either urgent cases, which will be seen in less than a week's time, or semi-urgent cases, which will be seen at most in about 14 weeks' time median. So if you look at those figures from this perspective, you will see that actually the 205, although it looks alarming, is the longest waiting time for people. But still, the median waiting time of several months and over 1 year, and in this particular case over 3 years, is not satisfactory. So there are lots we can do, especially in terms of public-private partnership, so that stable cases can be transferred to the community.
Right. Mr. Lin, what about you? What are your thoughts on the overall situation? This problem of long waiting time for public health services is not new. Has the situation improved much over the past few years?
Well, not really. We see the situation actually worsened in the past year. Even before COVID-19, the waiting time for specialist outpatient is very, very long. And I agree the waiting time vary from different specialty and different cluster. But keep in mind that the waiting time for outpatient clinic is only a fraction of the total waiting time. Because many patients, when they finally get to see the specialist, they also have to wait for checkups like ultrasound, CT, MRI, and even after they finish the checkup, they also have to wait for the actual surgery. So the total waiting time for outpatient clinic plus the checkups plus the surgery is a lot longer. So it's a long problem. It's very serious.
Yeah, so Mr. Lin, the chief executive, and really the government has for years now saying that we need to encourage collaboration between the public and private sector. Is that working out well?
Well, we see some project of public-private partnership, PPP, in the past. but the participation rate is not very high. There are a lot of concern from the patient side. They may worry that they cannot get back to the public system once they leave the hospital authority. Also, they also worry about the extra costs that come with going to PPP. And so we need a new scheme to improve the participation rate, and we need to develop more schemes. Because right now, the majority of the PPP scheme is focused on several diseases like diabetes and hypertension, and we need to expand that in order to balance the system.
Yeah, so Dr. Lam, Mr. Lin has pointed out the cost on this public-private partnership is a problem. How can we solve that?
It is actually a big problem, and I totally agree that is the crux of the problem, or most of the problem. Now, the challenges are there. Our population is aging, and by 2041, which is not too long from now, a third of our population will be elderly, and the non-communicable chronic diseases will still rise. We have just the hypertension public-private partnership running for some years, and the participation is low. There are roughly 40,000 patients on the program and about a few hundred doctors. So there are inertia from the patient side and inertia from the doctor side. Now look at the patient side first. What are those worries of these patients so that they do not want to get back into, they do not want to get to the community to see the family doctors? Now, first of all, they are worried that if they leave the specialist outpatient clinic, they can never get back. That means they need a fresh referral, and that takes another 2 years of waiting time before they can be seen by the specialist outpatient clinic doctors again. So this is something we can certainly improve. I've always told our colleagues in the in the hospital authority that they should not be closing these cases. Rather, they just transfer the care to the community for the time being. That means the primary care doctor can still talk to you in a specialist outpatient clinic and arrange for the patient an early follow-up at the SOPC in case the patient becomes unstable. So it's a partnership, a co-care of the patient, instead of like dumping your patient to the primary care doctor.
Right. So we do have an e-health system in which private doctors can look at a patient's record quite easily. But like I said, let's get back to the question, cost. When you go into the private sector, private doctors, the fees vary. Some charge $200, some charge $900. This is a worrying point for the patient, isn't it? How can we address this? For example, can we have maybe an insurance system so that people can, pay out of that? What can be done about cost?
Currently, the hospital authority pays. So with the PPP program, people who are offloaded from hospital authority SOPC to their family doctors, the consultation fee is basically covered by the hospital authority. What the patient has to pay himself is just exactly like what he has to pay when he sees the doctor in a specialist outpatient clinic.
But the consultation fees are all over the place. Some charge $200, some are $700. Well, it's uneven.
No, it's the same thing. He has to pay the same amount of money if he sees his family doctor, whether he's seeing his family doctor or seeing the specialist outpatient clinic doctors. And the drugs are also the same.
No, but I'm talking about the consultation fees. Some private doctors charge a lot more than others. And so if you go to the private doctor, down the road, you find out this person actually charges $500 and you can only claim back a small amount from the public sector. Isn't that the crux of the problem with PPP?
You got it wrong completely. No, you got it wrong completely. If you join the PPP program of the hospital authority, that means when you start off yourself being a patient of the SOPC, you join that program, and then through that program, you see your family doctor. All you have to pay is exactly the same as you're paying when you see the specialist outpatient doctor in hospital authority. And that covers the consultation fee, the drugs. So it's basically the same.
And
of course, if you're talking about completely private scenario, that means I want to choose some professor in Central, then of course you have to pay out of your pocket, and that is this dual system that Hong Kong has
And for patients who are receiving welfare payments like CSSA, is it actually free?
Free.
Free of charge for the consultation,
free.
Right?
Yes, free. If they join the PPP program, then it's completely free, whether they're seeing the doctor in a specialist outpatient or seeing their family doctor through this program.
Okay, so another point that the chief executive has been talking about is prevention rather than cure. That because of the aging population, we should focus on people taking care of themselves rather than overwhelming the public healthcare system. Mr. Lin, what can we do to improve on prevention?
Well, prevention seems like it takes a long time to work, but actually many SOP cases could be handled in the primary level that include prevention and long-term care. So it actually immediately helps the SOP waiting time as well. So we think that now many minor issues are handled in SOP and monitoring the situation, and this could be downloaded to the primary level. And also prevention and it included it's the whole primary health system, including prevention and long-term care that could support the SOP and reduce the waiting time. So the whole system needs to be built up, include prevention and long-term care.
Yeah, Dr. Lam, building up the community outpatient centers, what can be done to improve on that?
The concept is completely correct. Yes, that is the way to go. Preventive care. So if our population is healthier, then you have less patients who are ill when they get older. So the first thing is to modify our diets and modify our lifestyle. So more exercises, eat more healthily. So that goes down to the family doctor, who is supposed to be the general manager of our healthcare, and also the district health centers, which again, they provide lots of healthcare advisors, health exercises, and diet advisors. So that's just prevention, the primary prevention. And another level is screening for common diseases. So if you detect hypertension or diabetes early, then the chances you have a better chance of controlling them in a good shape. And then the possibility of complication is very much lower. So screening for common diseases, and there are not many of them, luckily. So we have diabetes, hypertension, high cholesterol, and some chronic obstructive pulmonary diseases, and of course dementia is another issue. And then when you go to cancers, there are a few cancers that we can screen for, like colorectal cancer. We are already doing a colorectal cancer screening program. Breast cancer, which is also being screened at the moment, and cervical cancer, which is not only screenable, but it is also kind of preventable if people get their vaccine early in their adolescent stage. So there are many things we can do to improve the health of our community. So if the health improves, then the need for seeing doctor will go down.
All right. And Dr. Lam, I know you have to go soon for your LegCo meeting. Just finally, what about suggestions about allowing patients direct access to specialists without a doctor's referral, just like physiotherapists? Would that help reduce pressure on Hong Kong's healthcare system?
It will be a big change. We're not talking about specialist doctors. Specialist doctors, they can see the specialist doctors anytime already. So unlike in UK, where you have to get through this general practitioner before you can see a specialist doctor. But I understand you're talking about like physiotherapists. In Hong Kong, they are actually already providing some very frontline services to people without any referral. For instance, if you go into a district health center, the elderly goes into the district health center, they are assessed by physiotherapists to give them proper exercise to strengthen their muscle and also improve the balance. That is already a kind of physiotherapy, although we do not really write it down like that. So certainly there is a role there. But then the second thing is, what is the scope, right? We are always concerned that without a diagnosis, there are certain things you should not do, such as if you have a low back pain for, say, 2-3 weeks' time, and it's not precipitated by a trauma, and it comes in an elderly gentleman, then there stands a chance of it being a metastasis to the bones. So you must see a doctor and get a diagnosis before you go and see a physiotherapist. So there are certain situations where we have to limit the access. And I think that is still in the pipeline, and we're still actively discussing on that. Overall, I'm positive. but then we have to set the scope very carefully. And the second thing is really the experience of our therapists. Now, the physiotherapists in Hong Kong, they undergo a 4-year structured training as undergraduate training, and the level is very high. But then 4 years is not a very long time. They need some more experience so that they are really safe for the public when they see patients directly without going through the doctor. So again, that takes a bit of discussion, and we are already discussing that between doctors and other stakeholders, and of course physiotherapists as well.
All right, Dr. Lam, thanks a lot for joining us this morning. That's Dr. David Lam, the Medical and Health Services lawmaker.